Hello friends, welcome to Creative Medicine. In this lecture, we will learn about Kullu, a 24-year-old alcoholic, was brought to the psychiatric OPD with history of behavioral changes. According to the family members, he has become suspicious that the people are trying to conspire against him. Though his father states that there is no reason for his fears. Kullu also reports of hearing voices that comment on his actions. Okay, number one, so first he is suspicious and conspiracy. That means he has the delusion of persecution. Number one. Number two, the patient also reports of hearing voices. That is, the patient is having hallucinations. That is, auditory hallucinations are seen. So both these will look as a schizophrenia. Okay, so this is the diagnosis of schizophrenia. In delusional disorder, the patient will have one prominent delusion, but other modalities of the life are completely normal. Okay, but here the patient is also having auditory hallucinations. So it is not delusional disorder. Delirium tremens is a withdrawal symptom of alcohol where the patient develops tremulousness, that is hoarse tremors, progressing to hallucinations and stupor, all those symptoms due to the withdrawal of alcohol. Thank you and thank you for watching.